Okay.
So, welcome everybody, and welcome to Christine. We're so thrilled that you could come and be with the group tonight, and I know that you've been busy clinically today, so I really appreciate you extending the day out and coming and sharing some time with us and sharing what you know. Just to say out loud that we're videoing the session so that people will be able to watch it later, and I guess because of that, I'll give the general disclaimer that if there's anything that people sort of feel like, oh yeah, I could take this on board, don't forget to talk to your doctor. So if you're thinking about taking any extra supplements or doing any complementary and alternative or complementary therapies, then we'd always encourage you to just have a chat with your doctor about what you're planning to do. And of course, like, give me a ring if you're sort of thinking, oh, what is all of this about, and you're confused or you've got questions, and you're always welcome to give me a call as well. And questions that I can't answer, I might even pick Christine's brains about later on. But yeah, look, and I'll throw to Christine. Thank you so much and welcome. I'll let you introduce yourself. And are you happy for us to ask questions as we go, or should we save them until the end? Or?
No, whatever you like, really. Please do, if it's easier to. Just ask me questions whenever they come up.
Thank you.
Thank you for having me, and I love talking about acupuncture, so at any chance I'm happy to come and talk some more about acupuncture. My name is Christine Lee, and my background is in Chinese medicine. I've got a double degree in Chinese medicine and in human biology from a university here in Australia, and I've been working for 10 years. I'm registered by APRA, which is an umbrella organisation that registers, nursing and other allied health practitioners as well. And so, even though acupuncture is seen as a complementary therapy, it's actually really heavily regulated, and we have to work within really strict guidelines in terms of what we can say about what acupuncture does, but also in terms of safety as well. I work in a GP clinic or GP and allied health clinic and an oncology support clinic as well. So working with a lot of people going through cancer diagnosis, treatment, and after treatment as well. Today, I know it's a short session, but I want to really briefly talk about acupuncture, what it is. It's some of the foundations that inform the way that we think and how we practice, and then move on to, I guess, the more sciencey parts of things, what's actually happening when the needles go in, and what you can expect in terms of treatment for some really common symptoms in terms of going through cancer treatment. So acupuncture, what is it? Acupuncture, there's a lot of different styles and different ways of practicing acupuncture, but basically it's the insertion of needles into the body, where you can expect a local change in your tissues, but also change elsewhere as well, systemic change in the body. It has a long history. This is a fossil that was found 15,000 years ago with tattoos where acupuncture points are, and they know that this fossil was, from someone that was receiving acupuncture for back pain, and he was actually found in Italy, frozen in the Alps, so used for a long time. And they think that acupuncture has been used since caveman times, and it started from using hot stones, so hot stones placed on the body that cause some relief in terms of pain or therapeutic relief, not just there but elsewhere as well. That kind of therapy moved to using stones and bones into more sort of evolved tools that were used in ancient Chinese practice. And so evolved, but probably evolved a lot more to the kind of needles that we use now, which is very fine, single-use, disposable needles that are, disposed of safely and used under regulations, so under clean needle technique, and in environments that are clinically regulated or more safe. So there's so not only do we use acupuncture needles in a lot of the more traditional acupuncture points, but technology has evolved to the point now where there's a lot of other techniques that we use. This photo is of electroacupuncture, which comes up a lot in the evidence that you read, because it's quite effective. What it is acupuncture, but a small current is run through some of the needles as well, just to increase the therapeutic benefit of that. And this is laser acupuncture, where there isn't any needles involved, but a cold laser is used on acupuncture points to create similar changes in the body. Laser acupuncture tends to, I would really use that more with children or for people who are super sensitive. So it has a small effect, and when a very small fine effect is what you're after, that's probably when it's most appropriate. But electroacupuncture really quite effective and showing a lot of changes that are measurable as well.
What's the gauge of the needles that you use to insert a laser?
I use, my usual needle is a 0.2 gauge.
0.2?
Yeah, so it's about a tenth of a syringe. Yeah, it's about as fine as the width of a human hair. So much smaller than the syringes and things that you normally find in hospitals. Acupuncture is found in lots of different environments now. So while I work in, I work in an allied health clinic. I used to work in a Chinese medicine clinic. It's actually used a lot in the military now, by the military in the United States. They use a lot of ear acupuncture because it's really, found effective for pain relief and also for really acute mental health situations. And it's also used a lot in hospitals. And so this is a picture of Dr. Byong Sang O, and he works in radiation into oncology departments in Sydney and provides acupuncture on site in oncology wards. I think it's just Olivia Newton-John here in Melbourne that provides acupuncture in a hospital setting, but there's more and more, and there's trials going on because it's been found to be effective and with very, very low risk in terms of the help that it can provide. Just quickly touching on the philosophical foundations of acupuncture, because it's quite difficult really, to discuss the effect without some of this. So I don't want to go into it too much because I know it's a whole different world. But basically, acupuncture comes from an Eastern tradition where we look at yin and yang, and the idea of yin and yang is that a lot of the way that life moves is between two different poles. So between positive and negative in terms of electricity, day and night, and so on. And a lot of the way that acupuncture or Chinese medicine looks at things is that we see that in the body as well. And so our bodies regulate from one to the other. And so, we need to rest to be active. We need our nerves move between the same electric poles. And when that regulation function goes out is when you start to see some symptoms. And so we look at trying to get that natural function back into harmony. And it forms the basis of a lot of the way that we diagnose and see where problems come from.
And the feminine and masculine side of things?
Yeah.
Holes put on to live those sets of criteria?
Yeah, look, I actually wasn't sure whether to leave that in. That is probably less relevant in the application of medicine. So while we recognise that, that there is that difference in feminine and masculine, and it takes both to, not just in people, but just in nature, it's probably something that comes up less in clinical medicine. Let me see if I can think of it.
Is it similar to like European verbs where not verbs, but in German how things have a masculine or a feminine?
Yeah, it might come from the same ideas.
That's right.
My table is masculine and things like that in the German language.
Yeah.
Which is weird. The dirty is nice.
Yeah, they're the words. It's, I can't remember, it's a long time.
Well, I learned it, I'm thinking, why is a table masculine?
Yeah.
Yeah, look, I think it's really hard to sum up in one or two sentences, but I think there is some foundation in it that when things swing one way, look, I'm going to leave that actually and see if I can think of an example later on for you, but it's probably not as relevant in terms of medicine. The other thing that we work on a lot is qi, which is a word that comes up when we talk about Chinese medicine and acupuncture. Qi has a lot of definitions and it can be quite confusing, but in terms of medicine, a lot of the time it's used in the context of function. So lung qi is lung function, kidney qi is kidney function, and when so we work on building that or moving that. But while it is function and it's a measurable function, it is at the same time a substance that moves in these channels, and the channels can be obstructed or reduced or rerouted, and so it's important to make sure that that qi is moving properly so that function works properly. So I might move on to what happens during acupuncture in a sentence or in words that is a little bit more accessible in terms of the way that we understand the body. So what happens when acupuncture, or what happens when there is what happens during acupuncture? Acupuncture has been shown to regulate blood circulation, so move blood or change the way that blood is moving in our bodies. A really famous example is that spleen 6, which is a point on the ankle here, has been shown to increase blood supply to the uterus and to the ovaries, and so is used quite often in birth induction or in treating menstrual problems and things like that. And so that's been shown quite conclusively that distal points can affect blood circulation in other places. Something else that happens during acupuncture is that brain activity changes. And this is a good picture that explains that. So this is a picture of a regular healthy brain, and then this is a picture of someone who is affected by carpal tunnel syndrome and affected by pain in their wrist. This is the same picture, or a picture of the same person, but after acupuncture. And so while that is still happening to their tissues in their hands, the perception of the pain has been diminished in their brain. And so it gives, when working with pain, we try to reduce the central nervous stimulation, that perception of pain, just so the tissues have a chance of healing as well. And so we need to work in both the perception and the central nervous reaction, as well as the local. Something else that acupuncture helps with is that it can help with regulating gut motility. And so it's been shown that a point down here in the leg, stomach 36, which is quite a big point, can help in terms of regulating gut motility. In cases where there's constipation, it can help move the gut, and in cases where there's diarrhea, the same point can be used to reduce that physical reaction.
Do you know, is there any thoughts about what's changing to change that motility? Because I guess in lots of people with neuroendocrine tumours, their tumours are producing too high levels of the serotonin, and that causes secretory diarrhea, or sometimes it's other hormones that are involved in that cascade that mean that they've got this horrible, horrible diarrhea. Do we know, are there any theories with the acupuncture regulating diarrhea about what's actually going on there.
What's
And
happening?
I imagine there hasn't been any studies in neuroendocrine tumour patients and whether acupuncture would help with that, but it's, I'd be interested in.
Well, I'll jump ahead.
Yeah,
So
sorry.
this is about transmitter receptors and the fact that, you know, there has been studies in terms of acupuncture not being able to change the secretion of those neurotransmitters, but the activity of the receptors, so how much is being received. And so there has been studies to show that acupuncture can affect the receptors for adrenaline, serotonin, acetylcholine and GABA. But in particular, I think that, look, I put this slide on because I think it is really quite relevant, that what happens, well, this is a study where, not with neuroendocrine tumours, but with subjects who had, I think is called CVH, chronic visceral hypersensitivity, which is not a condition that we see, but a condition that is categorised for studies. But basically, when the digestive system is flooded with serotonin and there is too much stimulation from neurotransmitter secretion. And so what this showed was the same again, EA's electric acupuncture that I showed you before, electroacupuncture at points in the leg or stomach 36 did decrease the number of receptors that was reacting to the serotonin. And so while we can't really change the secretion of a tumour or any other reason why that serotonin is being released, it can really change how, or it can really help regulate how the rest of the body is receiving that. A lot of the time in terms of working with pain, but also working with other symptoms, what we can do is change how that's being received, and those messages being sent to the brain, or messages staying in the nervous system, in the gut, the mesenteric nervous system. And so, you know, that nervous system doesn't have to be so sensitized or so reactive to what's there. Sometimes we can just put a filter on and stop the reaction to the circumstance. Does that?
Really fascinating.
Yeah. Look, I think it's really good to have that picture of what's happening. Usually what I see is that symptoms go down. And so people would describe that their symptoms are settled. It's not that it really changes anything, and it's not that like taking an Imodium or something where everything stops working, but it just seems to settle the overreaction. So bloating settles and you know, diarrhea slows down, and people find that they can challenge themselves with certain foods before having the reaction that they're used to having. I think that does go back to that idea of yin and yang, though, of just being able to regulate, to make sure that the messages are, you know, the right amount of messages are being sent rather than flooding the system with too many messages. Coming back to other things that happens during acupuncture. Acupuncture can cause a release of endorphins. I think that that's something that, you know, that knowledge has been around for a while. Just the fact that people usually get off the bed feeling a little bit happier and their pain tolerance is a little bit lower. That kind of endorphin release, you know, has been shown to, look, I might leave that, but that kind of pain relief has been shown to be, you know, pretty standard and, you know, sad to say, fairly temporary as well. So you're kind of expecting to feel good for about 6 to 24 hours afterwards, and things do change. For that, you know, in that time, it's helpful, you know, because other systems can go back online. So in that time, people find that they sleep a little bit better, which actually helps their sleep the next day anyway. And, you know, just to have a little bit of time to feel yourself and to feel calm again means that it's actually easier to improve function across life. So even though it is temporary, I think that it's important in terms of a longer course of treatment, that things do, you know, larger things change over time. That's the neurotransmitters. Acupuncture has also been shown to regulate stress hormones in terms of cortisol and corticosterone, which again is a little bit specific in terms of when there is stress, it can reduce that stress response, but when stress is necessary, it can actually help secrete cortisol as well. So when there's inflammation or a lot of pain, you actually need a little bit of that, and acupuncture the same point can actually increase the secretion. So just in terms of helping the body decide what it needs and affect that more quickly. So there's been a lot of evidence in terms of or clinical evidence in terms of what acupuncture can help and how much it can help. I'm not going to talk about all of them because I don't think there's enough time, but really happy to answer any questions if you have any about specific symptoms. I wanted to talk about fatigue because fatigue is really important, and it's something that affects most people during the course of their treatment and after treatment. This is a new review that came out that was that has pretty much put the science now is pretty substantial and conclusive that acupuncture can help with cancer-related fatigue, and that's looking across a number of trials and looking at the effect of acupuncture compared to people with who have received sham acupuncture, which is a placebo, and then compared to people who haven't received any acupuncture. It's pretty conclusive that there is a significant benefit, and that benefit usually comes about in a course of 6 to 10 sessions. What they've found also is that it doesn't actually matter how long the needles have been left in, how frequently that you get the acupuncture, whether it's once a week or twice a week or every day, and how long that course is over. So over a month or over 2 months, that there is that significant effect. I think that, coming back to the endorphins before, that tends, that's pretty much guaranteed that there's going to be that feeling of wellness and ability to do things immediately after acupuncture. But then it takes another 3 or 4 sessions before people start to say or to report that they're waking up a little bit better or able to, walk a little bit further and able to get onto that program where they're, increasing their exercise 10% every week and so on. That usually takes a little bit more time before you see that response. But generally, there is a good response straight away. It's not something that you have to wait a long time for.
So is that when you do that's sort of saying acupuncture, but what parts of the body are you targeting then to do the cancer-related fatigue, or is it just sort of general acupuncture?
Well, that magic point on the leg tends to turn up. Acupuncture, even though, look, all the studies have been on a lot of the major points, but as acupuncturists, we tend to still make a diagnosis depending on the person and depending on their presentation, and that can be quite different for different people. So someone who's not sleeping and sweating a lot will have a really different diagnosis and point of prescription compared to someone who is losing all their fluids through diarrhea, for instance. And so, yeah, don't know if that answers the question, but it still is quite different from person to person. Nausea and vomiting, also another condition or symptom that there's a strong evidence for in terms of acupuncture. That picture is of a point that you might find, little tools in the pharmacy to activate those bands for car sickness and travel sickness. That's an acupuncture point that actually is quite helpful even just to press. It's between the 2 tendons and 3 fingers down from the wrist crease. And I find that, if I have car sickness, that pressing hard enough will actually stop that straight away anyway. I think that, so the evidence is really quite strong and it's used quite a lot in where it can be in hospitals. Clinically, I think people respond quite well to the steroids and the antiemetics that they're given with chemo, and sometimes it's only really if there is still nausea, 3 or 4 days after chemo that, or after surgery, that it becomes relevant to try acupuncture, or that acupuncture can be helpful. And in that case, it's usually just the one treatment that can settle things down and, you know, help people keep their food down and keep their fluids in as well. Yeah.
Can I ask, do you think it's worth trying then for people if they've got nausea? Is it worth trying the travel bans?
Yeah.
For that, like, if, you know, even if they don't want to necessarily go out and find themselves an
Acupuncturist
practitioner, even just trying the travel bans.
I have never tried one, but I find that if I press the point hard enough, the nausea goes down. But the moment I take my finger off, it comes back quite quickly. So I think some of them have little magnets, which might make it a little bit stronger. It's definitely worth trying, and even the acupressure will make a difference. And so definitely, you know, worth doing.
A lot of our patients get nausea as a symptom.
symptom.
So,
Yeah.
it's one of the most common symptoms of neuroendocrine tumours. So.
Okay, so ongoing nausea. Yeah. Look, I would definitely recommend trying that. Then those travel sickness bands, and it's
I mean, they're
really easy
nothing,
to find.
You know, they're
Yeah.
easily.
A lot of the time, clinically, we can also there's a special little tool which is a needle that's attached to a band-aid that can be left in. And so for patients who come in but do suffer from ongoing nausea, they can be given some to take home with them to use ongoing. I would say that even though, you know, that's a symptom that's chronic, it's something that acupuncture could address in terms of, you know, making a change that's ongoing. So I would say that even though the situation remains, that there's going to be stimulation in the gut, that stimulation, the body can change its reception to that. And so a course of acupuncture probably would change it so that it's not necessary to keep using acupressure or one of those bands. But definitely it should, you know, it should help. And it's definitely worth a try.
And post-operatively, is that also beneficial to be doing or trying that straight away?
Yeah. You mean the travel band or the pressure point?
Yeah, either one.
Yeah, definitely. Look, I would. Does anyone here have nausea now?
I have tried it and it hasn't worked just with pressure. If it doesn't work with just pressure, does that mean you probably won't work with the bands and the needles too on that spot, or does that mean that's...
No, I would say that you need stronger stimulation, and so you might be better with acupuncture. But can I show you how hard I would press? Because you do actually have to press really hard. So this would be the point here, and I'd probably go about that hard to affect the change. Is that what you would be doing?
Yeah, now.
Yeah. So you do need to press very hard, and it might help to just pulse it a little bit as well. If you're not finding any change, look, I think it would still be worth trying acupuncture, but if it, can't guarantee that it's going to be effective for you. Yeah. Thank you. And so with diarrhea as well, which is similar to what I was discussing before, because there's so many causes for diarrhea and abdominal or digestive complaints in that group of cancer patients, there's not really a lot of trials in terms of whether acupuncture can help. But this is a trial this is an analysis of a group of trials for patients who have IBS symptoms or diarrhea dominant IBS symptoms, which is quite similar in the fact that it's from my perspective anyway, that it's a hyperstimulation of the gut. And that's found that acupuncture is actually quite helpful in terms of reducing those symptoms, and more helpful than using any medications, really. And then similar again for constipation, as well that acupuncture can be helpful and produce results quite quickly, and then over a course of treatment as well, and more helpful than taking laxatives. These are actually quite gentle laxatives, lactulose and senna, but I would say that acupuncture is quite more helpful than stronger laxatives as well, just because after a course of treatment you'd expect that that change is ongoing or is sustained. What we try to do is, in Chinese medicine, for constipation, we'd look at what was causing that, and that can be quite different across different people, and actually try to work from that point rather than just treat the symptom. And this is a little table that I put up, that I made, just to show that, you know, sometimes there are some really immediate effects, but for some symptoms it can actually take a little while before expecting some change. So for instance, with hot flushes, it can actually take about 3 or 4 treatments before people start to notice that changes are happening, and they're sleeping a little bit better, and so on.
I noticed that you've got neuropathies up there. Is that dependent on the cause, or?
So the evidence is for chemotherapy-induced neuropathy, and that actually responds a little bit in time, but neuropathies tend to respond better when it's the focus of the treatment, just because it takes a lot of needles. And so I wouldn't necessarily put 30 needles in someone who who has a lot of symptoms, including neuropathy. I just find that it takes away from everything rather than, yeah.
And does acupuncture affect any other treatments, like any other cancer treatments, natural treatments, etc., etc.?
It depends on what you mean, but so it doesn't affect.
Is it contraindicated if you're taking, say, herbal medicine from a naturopath, or if you're having chemotherapy from a mainstream doctor?
Yeah, no, I think that's also another reason why it's been, it's been taken up, because there is not a lot of risk and there's no contraindication. I think some people are wary of needles if there's lymphoma or anything, in terms of infection risk, but I'd say that risk is quite low, or, I don't know that there's any increased risk at all.
Because they're putting under, like, you use alcohol wipes and they're sterile needles, just like if we were doing, a blood test or an injection, really. So
yeah, exactly.
Except it goes less. But how far do they go in?
It depends on the area and the person. So it depends on the point. Is probably the better answer. They usually go in about 5 to 10 mil, so up to a centimetre. But in some of the more muscular areas, you can go in quite deep. So for hips and things like that, when you really want to have that local effect of changing the tissue, then I would go in quite deep. But a lot of the systemic stuff, so a lot of these symptoms, it's quite little.
Can I ask another question? Yeah. You might be covering this later on, so apologies if
No, actually, I'm open to questions. That was my quick.
What's the difference between acupuncture and dry needling?
That comes up a lot. So dry needling is more focused on local tissue. It's usually administered by physios, chiros, and remedial therapists who have that training in terms of anatomy and body work, and they put the needles in really they use some acupuncture points, but they also use motor points and trigger points, and really just to affect that local problem of, and usually it's pain as well. And so a lot of this more systemic stuff doesn't really come under dry needling. Yeah.
I think also, because I get acupuncture talk, I asked that question to the person I go to see. And the regulations of dry needling is nowhere near as much as it is on acupuncture. So there are much more regulations in how they put it in acupuncture than there is in dry needling.
Okay.
You don't, the training that you need to do dry needling is nowhere near what it is to be in acupuncture.
Yeah, but sometimes I don't know what dry needling is, because I honestly don't know what they learn at all. I think sometimes it's a
I had it
weakening
done and
force. Yeah,
it was awful at the time, but incredibly
effective.
useful.
So it's-
Yeah.
From what I gather, it's effectively a Western, it was done out of a study where they basically injected athletes with needles and then they injected substances, like they sort of put in something and then they didn't, and they found that they got the same result whether they injected the substance into the muscle recovery or not. And so that's why it's called dry needling, because it was actually, they found whether you injected, the recovery substance or not, you actually got the same, you got the same result.
Yeah.
Is dry needling effective at the areas that you're putting the needles in, whereas the acupuncture, like if you're putting a needle in there, it's affecting another part of the body?
Yeah. So it's informed a lot with that the Eastern philosophy as well of understanding qi and how that moves in the body. Whereas I think dry needling is much more informed by anatomy and the fact that the needle can cause some can reduce inflammation and reduce pain in that area. When you're looking for an acupuncturist, acupuncturist styles vary quite. They vary quite a lot. I think that in terms of, when going through cancer treatment and immediately afterwards as well, I find that patients are quite sensitive to pain, and so I highly recommend that you look for someone that does say that they're gentle in terms of their technique.